Ladies and gentlemen, I want to share with you how to make a diagnosis of diabetes. This is the CDC website, Center for Disease Control and Prevention, based in Atlanta, Georgia, USA, which is basically the leaders when it comes to diseases in the Western Hemisphere. Let's go down to business. So there is a chart which helps a lot right here. I want to share it with you. Forget about my face, that's irrelevant right now. Looking to the chart. This is it. This is it. So let's go first with what's the normal. That's quite relevant. What's normal? So a fasting blood sugar of 99 or lesser than that. Between 70 to 99, that's healthy, that's normal. Okay. If, however, let's go every column and then the next column. If someone has a fasting blood sugar of between 100 and 125, then that's pre-diabetes. Okay, so if someone has 126 fasting blood sugar twice, not only once but twice, then this person has diabetes. Okay, let's go to another test, random blood sugar test. That can be before breakfast, after breakfast, 1 hour, 2 hours, 3 hours after dinner, lunch, whatever. Doesn't matter. Just random blood sugar test. If someone has a 200 milligrams per deciliter or more plus symptoms, definitely, without any hesitation, this person has diabetes. Remember, 200 plus symptoms. What do I mean by symptoms? I will explain that right away. They lose a lot of weight. Okay, that's really obvious. Let's say between 6 to 8 kilograms in 1 month, which is basically 12, 13, 15 pounds in 1 month, not week, in 1 month, without changing their lifestyle, without changing their diet nor exercising. Okay, another symptom. They eat a lot. Take this into consideration. Usually, the cells need sugar in order to just survive and work. So if the sugar levels in the bloodstream are really high and are not getting inside the cells say, hey, what the hell is going on? I need food, I need sugar. Then there is a signal sent to the hypothalamus, and then the hypothalamus say, hey, what the heck is going on? I need you to eat right away. So eat. And this person starts to eat a lot. That's another symptom. Another symptom would be polyuria. I mean, they urinate a lot of big quantities. That's my point. Big quantities that can be explained with the physiology or anatomy or whatever you name it, like that. This is the bloodstream. Okay, this is vessels, arteries, and so on and so forth. This would be the cells right here outside of the bloodstream, cells, and this is the space between cells and the bloodstream. There are no cells here. Just pretend for 1 moment, level with me. Just pretend there's a cell right here. Okay, so we have a high levels of sugar in the bloodstream. Therefore, there is a phenomenon in which these high blood sugar levels attract water from this space into the bloodstream in order to have a more balanced bloodstream osmolar levels. Because if it's really loaded with sugar and no water, that's unhealthy. That person would die. So the bloodstream needs to attract water into the bloodstream. And all this water with all this sugar goes into the afferent arteriole of the kidney, basically to the kidney, and the patient starts to urinate a lot of water. But remember, there is a threshold into which we usually don't urinate glucose. If our bloodstream's glucose level is above 170, we start to urinate glucose. Okay, we understood that. And also because the patient is urinating a lot, the person or this person starts to drink a lot of fluids. Those are the basic symptoms of diabetes, which are related to this chart. Okay, you got it. Sorry. What about the glucose tolerance test? You know what? To be honest, almost nobody performs this test because it's a pain in the ass. I will explain it, but really fast. I'm gonna do it really fast. The patient is over here. Okay, we provide him with a glass of water or fluids with certain amounts of grams of glucose, 50 or 75. It depends on the author, and it depends if it's a pregnant woman or just a random person. After 2 hours of drinking that glucose fluids, we evaluate the blood sugar. If it's between 140 and 199, the person has pre-diabetes. Below that, that patient is healthy like me. Above 200 means that patient has diabetes. Okay, let's go down to business to the most exciting test, which is the H1C test, or the right name is hemoglobin A1C test. I'm going to explain this right away. It basically means how much sugar enters your bloodstream, and it is attached to hemoglobin. That's all. And it measures the average glucose for the last 3 months. That's all you need to know. In another video, I'm going to tell you how people, how we doctors do the evaluation to test for diabetes type 1. See you on the next video. Bye.